So I definitely feel better than I did before therapy. We started off, because she could tell I was so low energy and just blah. We started off throwing this ball back and forth, and whatever it was like a little soccer ball type of thing, and whatever your thumb landed on, that's what you read and said. So it was like, what's your favorite sport? What are 3 gross things? What are 3 yummy things? What are like, what's your first and middle name? Where were you born? What's the best birthday party? So we went back and forth answering these questions, and it was really fun because I got to learn a little bit about her, which was kind of cool, just like little things. And I got to just talk myself, and it was good. And I was laughing and smiling, and it helped me connect more. And then I started crying, and then we just did a lot of talking. And so I figured out a lot of stuff. Ooh, it's hot. I figured out a lot of stuff about what was going on inside my body, my emotions. And oh man, it was really good. It was really good. I love her. And I got these wonderful worksheets. I got my emotion regulation DBT worksheet. I have my distress tolerance, which helps me when I'm super anxious or mad or whatever, and I want to be able to cope with it. This is my mindfulness worksheet that helps me practice mindfulness every single day. This is my practicing opposite emotion, where if I'm feeling mad and I want to throw something, I write about how I do the opposite. And so right here, I put 5 coping skills, and if they made me feel better, and then typically, if the 5 don't work, then I focus on acting on my emotion, but that usually doesn't happen. All 5 of my coping skills usually work, and sometimes I'll go through 5 and then just redo them, or do another 5 if I want to, whatever I want. Usually if I pull a worksheet out, it helps me get where I need to be and want to be. If I get a worksheet after the event's already happened, sometimes it's different, but it always helps for future events if I do a worksheet, even for an event that's already happened, of expressing my anger or in whatever way. This is a story of emotion, so if I'm triggered by something, if I'm scared or mad or sad or anything, I can say what my vulnerability factors were, what was the prompting event/trigger, what were my thoughts and beliefs about the event, my body sensations or responses, the name of the emotions, and the actions that I presented after feeling so. This is the middle path practice. So this is sort of like, so an example is for people like in high school and they're still living with their parents. Say their parents are telling them to study and you don't feel like studying. The middle path would be, your emotions are valid that you don't feel like studying, but you have limited time to get your studying done, and it makes the most sense to start it now and get it over with, even though you don't feel like it. And maybe plan in the future to get like better sleep if that's the issue. But if it's just like you want to hang out with your friends or something, then get your studying done and then whatever. But for me, who I'm older, don't live with my parents or whatever, so I live with my boyfriend. So say that he wants me to stop yelling or swearing, but I want him to accept that I'm angry. Well, it's valid that I'm angry, but it would be better for both of us if I used a healthier way to express my anger. But it's an addiction, and you have to work on it and be patient with yourself and have a partner who understands and is willing to work with you, and not basically, if you have, it's a natural response for, say I'm always angry and my boyfriend now is always defensive because of my anger and chooses not to talk to me about stuff. Now it's my job to tell him, like, I understand that you're going to be defensive, but we need to work together to decrease your defensiveness and decrease my yelling, but we need to work together. So for that to happen, I need to work at it every day, and he needs to work at it every day, not assuming that I'm going to be angry. Because if he assumes I'm going to be angry, I'm more likely to be angry. Just like if you have an alcoholic or a drug addict of some kind, and the drug addict goes to rehab and they've been clean for a few months, and you know, they may or may not relapse, but if you assume that they're going to relapse, they're going to be more likely to relapse. If you assume they're going to manipulate you or that they can't be trusted and put this on them, you're just being part of the problem, and they're probably going to relapse because you're not giving them the support they need. So if you want someone to get over an addiction, the best way to do it is support them, and always recognize that in every moment they are not the person that they were the moment before. And my last worksheet is a self-validation practice where I say I'm like, oh, I'm too angry. Let's just do an example. I say, oh, I'm too angry. What are the thoughts about myself after I tell myself I'm too angry? I feel insecure. I feel guilty. I feel unworthy. So those are the thoughts about myself. And then how do I feel about those thoughts? I feel sad. I feel confused because I know that deep down my anger is valid. So the reason that I'm making this invalidating statement probably isn't coming from my own truth. It's coming from other judgments made about me. So I would also feel mostly just sad, disappointed, unloved maybe. And then for the I'm trying to understand myself non-judgmentally, I can let myself know I'm hearing, understanding, and accepting myself by making the following validating statement. So this is where I can say it's okay that I'm angry, and I know I'm working on expressing the anger in healthier ways. But it is okay to be angry. That's really the validating statement. I'm not too angry. Everybody's angry. Everybody expresses it different, and there's reasons for that. And I've had a very traumatizing past, and I'm doing my best, and I'm doing really wonderful, and I'm going to continue getting better. And then the last part is, how do you feel about yourself after using these self-validating statement? So my feeling words would be hopeful, encouraged, maybe joyful, excited. I'm anticipating the future of being able to accept my anger and express it in a way that I want, and in a way that helps me grow in my relationships. So these worksheets are just very helpful. So I'm going to try to work on them a lot this week, as well as that middle path that I mentioned before in my pre-therapy video. So I'm going to work on that, but I need to have a middle path for Howie to do, as far as not being so defensive with when I'm mad. So, because and it's normal for him to feel that way and be that way, but I'm just gonna have to explain to him that, he needs to work with me, and I'm sure he will, because he's very, very supportive. It's just a long process of I have a long way to go. I'm doing wonderfully, and I've come a long way, but I still have a long way to go. And a relationship is never perfect. There's always, you have to work at it every day. And I'm just really happy to be in a relationship where I have somebody who's willing to work with me every single day to grow in a relationship and to just love me unconditionally. And there's not any using each other, or everything's very even and fair. And I don't know, I'm just really excited and hopeful and happy. And also, I think I'm gonna ask him tonight, but I think we're gonna start reading this book called Attached, because we've been wanting to read a book together. And then my therapist Rachel, she was mentioning to me about this book Attached, and it would be a really good book. It's a good book for couples to read, because or just people in general to read, but especially couples, or any type of relationship really. But basically, people want to be in relationship with each other usually. People they love being in relationship. And so as far as, especially with a romantic relationship, you attract people different attachment styles attract different attachment styles. And so you get your attachment style basically when you're like a baby, when you're a kid, a young kid, and then you can change that attachment style if you're aware of it and work at it. Like I have a disorganized attachment. I'm not sure what my boyfriend has, but I'm assuming it's either like I think there's like a stable attachment, but there's also a I think he's either stable or maybe a little bit avoidant, but probably more stable than avoidant. But I'll have him take the test and see. But the avoidant is usually what I would attract, what a disorganized would attract. But since I've been working on my mental health so much, maybe I did attract someone stable and not avoidant. Because my last relationship was 100% avoidant, and he's not really like that. Like he's very, very different. Like if I sit down and talk to him, he's willing to work on whatever we're talking about and to focus on it and to active listen, and so it's really great. But yeah, I think that's it. So I got my worksheets. We're gonna probably read this book called Attached. It's gonna be really good. I'm excited. I didn't realize how much sadness was rooted in my relationship, because like I'm very happy in my relationship, but it's just very hard for me to be in a relationship with anybody, especially a romantic relationship though, just because of all my trauma and stuff. But it's just really good to know that like it's gonna be okay, and I'm not gonna just give up because there's nothing unhealthy about our relationship. It's just that I have like a lot of trauma that I'm still trying to work through, and so there's a way to fix that. And so I'm glad I'm in a good supporting relationship where we can work together to have the best healthy relationship possible, and it's gonna help me get through my trauma in many ways. It's like a big old web, so I'm excited. It's gonna be good. That's my post-therapy video.